Healthcare assistants may go on strike next month unless the HSE comes to the table for talks on working conditions. 95% of SIPTU staff in the Home Support Service have voted for industrial action up to and including strikes. They say it's due to the employer's failure to honour improvements in terms and conditions which were agreed 8 years ago. And services in Clare, Limerick, Cork, Kerry and Donegal could all be affected if a strike goes ahead. SIPTU Organiser Graham Macken is with me now. Graham, good morning to you.
Good morning, Alan. Thanks very much for having us on the show.
Thanks for being with us to chat about this. And can you just outline for our listeners who may not be fully briefed on this, what has led to this point?
Yeah, I think if I just start by saying, I suppose these particular workers provide a service to some of the most vulnerable members of society, and it enables people to stay at home in their own home environment, which is great for their families and themselves, and also it saves an awful lot of money for the government in providing places to nursing homes and all that kind of stuff as well. So, I mean, it's a great service they provide, and they don't get enough credit for it. But what's really happened with ourselves in the last number of years, Alan, is that we've had promise after broken promise over we're into the 8th year now. We have situations where we had an agreement where rosters were to be negotiated between the parties, the unions and management, so that people would have kind of fixed schedules within reason and have a proper work-life balance, and that there wouldn't be an over-reliance on agency workers and private providers. And this just hasn't come to any kind of fruition. We have a situation where some of our members would have, say, for example, a contract for 39 hours per week, and management might only put them in for, say, 30 hours one week, and then try to bank the 9 hours and get them to work, say, 48 in the following week. So, I mean, there are people in society that have a contract which, say, 156 hours over 4-week periods. That's not the case here. They have a 39-hour-a-week contract, and yet management are trying to mix it within a 4-week roster schedule, which isn't acceptable. We also have a situation, Alan, where we have a number of our colleagues that are expected to do an unfair number of split shifts during the working week. We have contracts which provide them with 5 days over 7, and yet we have individuals doing 12, 13, 14 days in a row. So we have a situation where there's genuine burnout for some of our members as well. It's just what they're being asked to do is very, very unfair. And it's just got to a point now where we're into the 8th year now, and the members have just said, look, enough is enough, and it can't be allowed to go on. And
one of the major concerns, of course, is the underpayments dating back 8 years ago. Just how significant are those arrears for workers on the ground? I'm just trying to imagine the kind of those mixture of hours, not being able to plan your life too well or have a good work-life balance, 30 hours one week and 48 hours the next, and then coupled with that, waiting on money dating back to 2018.
Yeah, I mean, Alan, we have a situation. How that has come about is that, for example, if an individual has a 39-hour contract and they, say, do additional hours in a given week, obviously they end up getting overtime rates and premium pay and all the rest of it. But when management basically say to an individual that we're actually only going to give you 30 hours this week, even though you're contracted for 39, then the following week when they come in and have to make up those hours, they're not being recognised for if they do 48 hours in the following week, they should be getting 9 hours overtime. But management is saying, no, that's not a flat rate because you owe us the 9 hours from the previous week. So it's a manipulation of the hours to avoid paying premiums. And you have a situation where we have some of our members would be sitting at home, and while we've no difficulty with a certain number of agency staff would need to be employed for unknown eventualities like sickness and that, but it's very frustrating for our members who might be available to do their full hours in a given week, and yet they're sitting at home doing nothing while management are actually actively bringing in agency workers or private contractors to do those hours. So it's extremely frustrating. And then, as I say, any premium payments or overtime rates are being manipulated by simply individuals being given less one week, which means they end up doing overtime in the following week but don't get recognition from a financial perspective. So it's terrible.
So Graham, between underpayments, rostering issues, burnout, excessive split shifts and inadequate breaks, all of that is affecting staff retention and care quality. In terms of the staff retention, it's hard to retain staff from what you're saying, but is it hard to replace them? I know you mentioned the bringing in agency workers, but those staff who leave the sector, I am sure they talk to people about their experiences from their viewpoint, and word gets around. Does that make it then hard to replace those staff because there are people who hear about all that and say, no thanks, that's not for me?
Yeah, absolutely, and you've hit the nail on the head. That's exactly the problem, because the difficulty we have now is obviously recruitment is difficult. It's a difficult job, and a certain number of people can do it, and it's a bit of a calling. It's not like your normal standard employment. But the difficulty we have as well is when management are going out there offering employment to individuals and recruiting staff, there's this ridiculous situation where an individual might apply for a role, and obviously they're looking for the HSE norm, which would be 39 hours, so that they can have a decent career and financially viable, that they can live their lives accordingly. And then we have management saying, right, you have the job here, but we're not going to give you a 39-hour contract. We'll give you a 20-hour contract. Now, in reality, those individuals will end up working in quite a number of cases the 39 hours, but because their contract is only based on 20, they don't have any security if they need to go looking for a mortgage or a loan or whatever, and so it's just not. It wouldn't encourage them to take up the position, and management they're offering out these shorter term contracts. Basically in an attempt to say that on weeks that it's not going to be busy, well, then we don't have to give individuals as many hours. But I mean, as we know now in our society at the moment, we're an increasingly ageing population. The service is only going to get busier. It's not going to get any quieter. So it's just false economy how they're trying to do that. But it certainly doesn't encourage people to take up the role when they're not actually being offered a full week's work in the first instance.
Graham, you've very well set out your stall there as to why healthcare assistants could potentially go on strike next month unless the HSE comes to the table for talks on the working conditions. But there will be patients and family members of those patients listening, and from their perspective they'll be very worried about the impact of potential strike action. What would you say to those who rely on home support services, who place such importance on it?
Yeah, I think, and I can understand that. I mean, from my own perspective, my own parents have carers in the house, so I know how important it absolutely is and the essential service. But I suppose what we have to balance between the two scenarios is there that if we continue to allow management to act in the way they are acting, and we have a situation where our members are continually suffering with burnout, then we have a situation where any continuity in the homes that they look after is being eroded away because individuals are becoming sick. They have to go out on sick leave. And then you have a situation where it's a self-fulfilling prophecy. We've already got pressures on the service with lack of staff. Individuals are becoming ill. That's creating a bigger problem for the service. And that ultimately is going to affect the clients, indeed, that the workers that we represent look after. And I mean, if ultimately the workers aren't treated fairly, they understand it's a difficult job, they understand there'll be problems from time to time, but if they're not looked after and given the reasonable respect that they deserve, they ultimately won't be able to provide the service to the clients they're trying to look after, and that has a huge knock-on effect on the clients as well as the workers. But I suppose just to say, what we would be really, really trying to encourage the HSE to do is come back to the table. We have a number of items that we need to do from a logistical point of view as regards before we can actually serve formal notice. We have the ballot in and all the rest of it. So in reality, Alan, there is a 4-week opportunity. We have to give 3 weeks notice to management before we take any action. So in reality, there's a 4-week period now between now and us needing to take any kind of action or any work stoppages, and that is plenty of time for us to get back into talks with management. We've even been in contact with the WRC. The WRC stands available to assist us. We will not refuse an invitation to go into talks, but the difference this time will be, instead of the last number of years when we've had talks and we have had no decision made by the members that they were going to take action, at least this time if we go back into talks and we have a 4-week period, it'll just focus everyone's minds, because management know that if we don't reach an agreement, there's no point in pushing it out any further than 4 weeks, because it'll be too late at that point and we'll have to take action. But it's not something we want to do. We want to talk to management. We're available at a moment's notice, and we will sit down around the table, but it has to be meaningful discussions. It can't be kicking the can down the road for another year, where, as I say, we're into the 8th year. So you could say we've left it very late to challenge management on this, or on the other hand, you could say we've been very, very patient. But I don't think anyone should be expected to take any more delays in this now, considering how long it's taken to date.
Well, look, given the extended time frame that you've outlined there, and given all the stakeholders involved, your members, but also the patients and their families who benefit from the home support service, there will be progress made on this issue. We have reached out to the HSE for a response on this. We'll bring it to our listeners as and when we get it. I suspect we might be talking to you again in the very near future, Graham, but for the moment, thanks for bringing us up to date with the situation.
Thanks a million, Alan, and thanks to your listeners.
Take care. That's Graham Macken, their organiser with SIPTU on that potential strike from healthcare assistants.